think there's just 85 of you online. I'm not sure, maybe the rest will join a bit later. But first of all, before we start today, basically we'll go through the synopsis of the course. So this is Veterinary Pathology 3, VPM 3417. Okay. For this course, actually is a different system from Veterinary Pathology 2, whereby the system that we will cover this semester include the integumentary system, the reproductive system, cardiovascular system, and the urinary system, and also the musculoskeletal system. So for this subject, the assessment is a bit different from pathology 2, whereby we will have extra practical exam. Okay, so not only we have the test 1, we'll have test 2, which will cover 2 system. Then we'll have the practical exam, the oral exam, and then your final exam. Okay, so what you will be assessed is that we'll be looking at your the PO1, which is the knowledge, PO2, your psychomotor or your practical hands-on skill, and PO3 meaning your critical thinking and problem solving skills. Okay, so those 3 will be assessed for this course. So I've given you the synopsis. I think you have gone through it, right? So now we'll look at the schedule. Hold on, yeah, okay. So for this one, as I mentioned, we have 5 different systems. So the first system is the integumentary system, which will be covered by myself and Dr. Fazila. You guys can see the screen, right? The Excel?
Yes, Doctor.
Yes, Doctor.
Yes.
Okay. For now, lectures will be conducted 100% online, but the practical session is supposed to be face-to-face. So for this Friday, I think we'll have the face-to-face because the other day we had a meeting and they were emphasizing that since you guys are allowed to come back to the campus, so they emphasize to have the face-to-face practical session. So I'll update you guys on that, but keep in mind that we'll have a practical this Friday and most likely it will be face-to-face lah, right? Okay, the next system will be covered by Prof. Nordin. Okay, the third system, which is the urinary system, will be covered by Prof. Hay. And next we have the musculoskeletal system. This will be covered by Dr. Sabri. The last system is the reproductive system. Dr. Anas will be teaching you. So if you look at the test 1, is supposed to be around 16th of April. We'll do it during the practical session. So next one, test 2 will be on the cardiovascular system and also the urinary system, where it will cover 10% of each system. So 20% there for test 2. So the tentative date for test 2 is on the 4th of June during the practical session as well. Okay, and then we have the practical exam. This will 50% is for the practical exam, whereby we will cover all the 5 systems. Okay, so each system will give you 3% marks. Okay, and then we have the oral exam, also 15%. And last but not least, the final exam, which will comprise of the 40% of the total marks. Okay, so I have to emphasize that you must give full attention or give your focus to this subject, because this subject has been known as one of the subject that a student can fail actually. Okay, so I think last year was the time that we had no failures at all, but previously we do have students that fail in this subjects. Again, I would like to emphasize that you give your focus for this subject and study well for this subject. Okay, so for the lectures, it will be following group 1 schedule, right? So we'll be combining both group. And then practical wise is the same for both group, MM1 and MM2. It depends on the pathologists covering the system. So you have to find out lah whether they have practical session or not, and whether the practical will be conducted online or face to face. But for me, so far, it's going to be face to face because usually the first week there'll be people going around and checking. All right, so most likely it will be face to face. All right, any question so far?
None from me, doctor.
All clear, yeah? These are okay. I have problem uploading all the material on Putra Blast still again today. So I will upload everything later when the system is okay. Usually it's every semester. I think the Putra Blast will be fine, I guess, starting from second week onwards. Hopefully it's not that late. The notes today also I will update or maybe email you a bit later, yeah. Okay. If there is no, oh yeah, sorry, I forgot to mention for group 1, the course coordinator would be myself. This is like the first time taking over officially from Prof. A. And for group 2, the course coordinator is Dr. Fazila. So anything regarding this subject, you can contact us, yeah. Okay. All right. If there's no other question, perhaps we can proceed to the lecture today.
Okay, doctor.
Yes, doctor.
Doctor,
Yes.
can you record the lecture?
Yeah. No worries. But first of all, please sign in your attendance. I hope you can open the link, right? Okay, is the link working? 106.
Yes.
Yes, very good. Okay. Okay, so you guys ready for the first lecture? We'll start now, yeah? Alright, so today's lecture is on integumentary system. As I mentioned before, myself and Dr. Fazila will be covering this system. So this system, there will be 8 lectures on integumentary system. The first 4 lecture by myself and the following 4 will be by Dr. Fazila. So the lecture today will be a refresher course basically on the integumentary system. So no worries about that. I believe this is just to refresh you about the integumentary system. So today the lecture will be covering the general facts about the integumentary system, the function, and also the normal. So even though this is a basic or refresher lecture, but I want you to memorize the images that I will show you later on, okay? Because you need to know the normal structure in order for you to identify abnormalities, okay? So this is very important. So remember all the images that I will show you later, all right? Okay, so the integumentary system is actually the largest system in the body, which comprises about 40%, right? And then it forms an anatomic boundary between the animal and its external environment, okay? So skin diseases can be an indicator of systemic diseases. For example, like hypothyroidism, you would see manifestation also on the skin, whereby you see like symmetrical alopecia, for example, right? And then Cushing disease, for example, those are example as systemic diseases. Then skin diseases can also lead to considerable economic losses, even in food producing animals. So sometimes when you see animals with skin disease, definitely you would think twice about consuming the animals, right? So when animals have skin diseases, sometimes they will be culled earlier, or maybe you cannot sell those animals because it doesn't look appealing, okay? And then skin diseases also can be zoonotic. Can anyone give example of zoonotic skin diseases that you can think of?
So, doctor.
Yeah, so yeah, we have so many example. For example, like sporotrichosis, ringworm, for example, right? Subcoptes or even scabies. Okay, those are zoonotic, whereby it can infect humans in contact with the animals. Okay, all right. So what are the function of the skin? Skin, first of all, it serves as a protection or barrier against ultraviolet light. This is mainly from the presence of melanin in the skin. Okay, and it also protects from mechanical maybe like when somebody try to hit you, for example, even traumatic, or maybe something try to hit you. So mechanical, chemical, anything very caustic like acid or alkaline, thermal insult, definitely if you touch something hot, for example, and or something very cold. Okay, it also act as an effective barrier to the loss of water. So for example, like people with a burn wound, they tend to lose a lot of water. Okay, and then electrolytes as well, macromolecules, and this is very important also. It protects from the invasion of microorganisms. Okay, skin also is a organ of sensation, whereby it has a lot of receptors for touch, pressure, pain, and temperature. Okay. All right. For thermoregulation. Okay. Skin is also important for thermoregulation, whereby you have special structures like the hair, subcutaneous adipose tissue, which helps in insulation of the excessive heat, will be evaporated sweat and the epidermis. Sure, what from? Okay. Right. So, there are also metabolic functions associated with the skin. Example, the subcutaneous tissue, major store of energy in the form of triglyceride. Okay, and then skin also is important for the synthesis of vitamin D from the sun. Okay, skin is very important also in for motion, shape, and color. The nature of the skin, where it is flexible, it is elastic, and even tough, allow motion and provide shape and form. Okay, processing the skin, for example, the melanin formation will help give the color to the coat and also skin color. So meaning to say, if for example, a darker colored skin usually will have more melanin in the skin. Even animals with darker hair coat, for example, black color, definitely it will have more amount of melanin in the hair follicle or the fur. Okay, and then this pigmentation actually prevents damage from solar radiation. Okay. So as I mentioned before, skin can be an indicator of internal diseases, meaning skin lesion on the skin doesn't have to be localized on the skin. It can be coming from the endogenous factor. Okay. All right. So skin is actually skin diseases is actually one of the most common problem that you would face when you become a practitioner. So it's very common. So you would definitely see a lot of cases related to the skin diseases. Okay. But I would like to emphasize that diagnosing skin diseases can be tricky because you need to rule out and rule in many factors because it can be affected by exogenous or endogenous factor, and you need to really get the age, the signalement history well in order for you to really come to a definitive diagnosis in skin diseases. Okay, so the skin structure, skin composed of the outermost layer, which is the epidermis. Then you have the dermis. You have the hair follicle or adnexal glands, and last but not least, the deepest most layer would be the subcutis, or also known as the hypodermis. Okay. So okay. Just a small quiz. One question. Which of the following is not a function of skin?
See, doctor.
So what's the correct answer?
Synthesis vitamin D.
Yes, very good. Okay, so you guys are paying attention. Very good. All right. So this is a very, very famous, what I say, common diagram showing the skin structure. All right. So as I mentioned, hold on, pointer. Okay, all right. Okay, so the outermost layer is the epidermis, right? And then you have the dermis, and the subcutis is the innermost layer. So pay attention that there are hair follicle and other structure. For example, you see here, there are two types of hair follicle. I will explain later in the lecture. Here you have the compound hair follicle, and also this one is an example of a simple hair follicle. Okay, then you have like the other structure in the skin, for example, the glands. Here you have the sebaceous gland and also the sweat gland. And then there are other structure like the erector pili muscle, which helps in the piloerection in order to help in the thermoregulation function of the skin. Okay. Right. Okay. So how does the skin look under the microscope? So histologically, this is example of a normal skin, right? So you see the topmost layer is actually the epidermis, is quite thin here, okay? And then you have the dermis, okay? This whole length is the dermis. And this area where you see like empty spaces are actually the adipocyte, which makes up the hypodermis or the subcutaneous layer. So you have the APM is the erector pili muscle, and then you have the sweat gland, and this one is the sebaceous gland. This one and this one is also the sebaceous gland. So this is the hair bulb, which is responsible for the formation of the hair follicle. So these are the basic structure that you should see in the skin. So this one, please memorize. You have to know the normal one before you can identify what is abnormal. Okay, right. So we look at the epidermis, the first layer of the skin. So epidermis consists of a few layers of cell or stratum. First of all, the outermost one is the stratum corneum. So diagram is basically made out of few dead cells actually. Okay, and then histologically this is how it appears. Okay, C is the stratum corneum. Then you have the stratum granulosum. So stratum granulosum, if you see, it is a bit darker in color because it has the keratohyalin granules inside the cell, so it gives a very darker color. And then the following stratum is known as the stratum granulosum. Stratum spinosum. Stratum spinosum, the name implies like a spine because usually if you look higher magnification, you see like leather-like structure that holds the all the cells together. Those are actually desmosome. Okay, the final layer is the stratum basale. Stratum basale is the one responsible to produce new cells. So basically what happens is that new cells are produced in the stratum basale, and then it moves up until it goes to the stratum corneum. Stratum corneum is mainly dead cells, okay? So in the stratum basale, sometimes you might see other cells like the melanocyte, for example, or maybe the Langerhans cells. We look at a bit detail later. Okay, and then if you see in this histological image, this is called the epidermal pad. It's like a projection, downward projection from the epidermis, right? And then you also have the derma papillae. This is like the outward projection from the dermis. So they form like a very strong bond because of the projection. I mean the interdigitation forms a very strong form. Okay, right? Okay, so remember the different layer. Again, I mentioned stratum basale is the basal layer. Usually it made up of a single layer of cell, sometimes cuboidal, sometimes columnar. Mitosis is rare. It's seen in normal condition because of low turnover rate. Usually from stratum basale to stratum corneum, the length, I mean the whole duration is about 1 month. Okay, normal. But in certain skin diseases, the condition might be a bit more faster. So then you would see a higher rate of mitosis because the skin needs to regenerate much faster. So the turnaround time is faster. Okay. Okay. Sometimes diseases like apa? For example, like pemphigus foliaceus or something like that, yeah. So the skin needs to repair itself so to produce faster rate. Okay. The stratum spinosum, which is known as the prickle layer, is made up of several layers of polygonal cells. Okay, and then you have the stratum granulosum, which is also known as the granular layer. It is made up of one or more cells thick, which composed of nuclear keratinocytes. This one, okay, stratum lucidum is a very special layer. Usually it is clear colored. You will not take up the stain, the H&E stain, so it appears very clear. So this layer is only present in thick skin, particularly at the foot pad or nasal planum. Okay, so these are made out of thin band of flattened unstained cells. Okay, so again, please remember stratum lucidum is a special layer that only occurs in thick skin, particularly in areas like the foot pad or the nasal planum. Why this stratum lucidum is present in that particular areas of the skin? Can anyone guess? Why do you think stratum lucidum is present in foot pad or even nasal planum?
Doctor, is it so that because ada friction, because dekat our foot kan, so it provides like extra protection.
Yes, very good. Yes, correct. Because if you can imagine the foot pad especially dogs, for example, even cats, they tend to, they run, they jump. So there is an area where there is a lot of friction. So this layer, actually, the stratum lucidum is actually function to reduce those friction or shear forces. Okay. So so that the outer skin layer doesn't simply slough off. Okay, right. So the last layer of the skin is the or epidermis is the stratum corneum. Another name for that is the horny layer. This one, okay, this layer is made up of many layers of dead, fully keratinized flattened cells. Okay. And then, okay, the progeny of the basal cell layer undergo differentiation during their outward migration. So I mentioned before, right? Basale, and then the cells will undergo maturation up until it dies. Okay, when it dies, it forms the stratum corneum. Okay, so then it will slowly be sloughed off. So that's why skin will continually produce new cells. So because of the this action. Okay. And then in addition to keratinocyte, the epithelium consists of 3 types of dendritic cells: the melanocytes, Langerhans cells, and in the indeterminate cells. So don't worry so much about these indeterminate cells. These are believed to be the precursor of these Langerhans cells. Not much is understood, but yeah, people believe this is the precursor for Langerhans cells. Okay, so these cells are normally found around the basal layer. Right. Okay. So again, I have to emphasize, remember this diagram so that you know what you are looking at. Okay. So this is an example of the epidermal dendritic cell, and as I mentioned, you do have melanocytes here, usually at the basale, whereby melanocyte they form like finger-like projection, and you will give color to the stratum basale cell, so that when the cells travel outward, the cell will have color or the melanin inside. Okay, and then skin also will have a lot of sensory nerve endings, so they are usually located also at the stratum basale around there. Okay, next, I mean very near to the dermis, because of the function of the dermis to support whatever cells that or the as a nourishment for cells in the skin. Okay. Okay. This is example of melanocyte in the stratum basale. Okay, they are very dark colored, sometimes brownish, sometimes blackish, depending. Okay, so usually they are around the stratum basale, and they form finger-like projection and will give the melanin pigment to the cells, and the cells later will migrate outwards towards the stratum corneum, where they actually are dead already and they don't have any nucleus inside. Okay. Alright. Another images, so that these images will stick in your head. Okay, so again at the stratum basale you have the melanin inside the keratinocyte, and then you have the stratum spinosum, and then the stratum granulosum, usually very dark purplish in color because they contain this keratohyalin granules inside the cells. Okay, last but not least, the outermost layer is the stratum corneum, usually dead cells, they don't have any nucleus inside. Okay, and then here you have the dermis that supports the epidermis. Okay, sometimes again, as I mentioned, the melanin might be brownish in color, so this is example. So again, this will give the color to the skin, and also melanin also is present in the hair follicle, so it will give color to the skin and also the hair follicle. Okay, so for the hair follicle, remember I mentioned there are 2 types. First of all, you have the simple hair follicle. This is very prominent in cattle and horses. And then another type of hair follicle is known as the compound hair follicles. Compound hair follicle because it is made up of a primary and secondary hair. Okay, primary is very usually very coarse, and the secondary is usually a bit finer. Okay, this type of hair follicle is commonly found in sheep, goats, dogs, and cats. So if you notice dogs and cats, for example, they do have like very fluffy looking hair coat, right? Right, compared to like cattle and horses, right? And then, hair follicle will undergo cyclic growth. In anagen phase, it is actively growing. In the catagen phase, it is transitional. And in the telogen phase is where there is resting phase. Okay, these are all, for you to remember I think you have learned this in your anatomy or maybe physiology. Okay, so remember compound hair follicle is made out of a few types of, composed of not only one. Usually simple hair, a follicle is just one hair follicle, but compound is made out of a few types. Okay, alright. So for the follicle, it is formed by the hair bulb. The cells are responsible for producing the hair follicle is in the hair bulb. Okay, then the hair follicle is made out of few structure. For example, you have the internal root sheath, the external root sheath, and at the base, the derma papillae and the germinal matrix. So hair bulb is composed of the derma dermal papillae and germinal So this is the bulb, hair bulb, okay, and then you have this is the shaft of the hair follicle. So usually these hair follicle are surrounded by other structure, for example the rectal pili muscle and also the sebaceous gland, whereby it will secrete sebum and it will the hair will help distribute the sebum on the skin. Okay, so closer look, all right, histologically. Hair bulb, you have the dermal papillae and also the germinal matrix, and then the hair follicle is made of the medulla, which is the innermost layer. Then you have the cortex, the outer layer, and then it's covered by the root sheath. So you have the internal and external root sheath. It is usually surrounded by other structure like the sweat gland, and then also you have the erector pili muscle. Here we don't have the sebaceous gland so much. Okay. Right. Again, the same diagram. Just to here, I would like to emphasize that, as I mentioned, hair follicle can give color, right? The color comes from the melanocyte, usually at the hair bulb. Okay. So the more melanin, definitely the more darker the hair follicle will become. Okay. Alright. This, okay, if you do cross section of the hair follicle, sometimes you see structures like this. Okay, sometimes it is very darker in color. For example, in this image, you will see definitely the internal root sheath and the outer root sheath and the hair follicle in the middle there. Or yeah, this one is a bit darker. This one is a less, it's a lighter color. Okay, but so it depends on the type of the hair follicle and also where you cross section. So please remember, it doesn't have to look like this. It depends on how you section the skin. Okay, it doesn't have to look like longitudinal. Sometimes you might see cross section of the hair follicle. So because I do have students sometimes confuse this as lesion, but in actual fact it's just a normal hair follicle. So like this one, the hair follicle, again you see the sebaceous gland, right? Right. So we come to the types of gland of the skin. Okay. There are a few types of gland present in the skin. First, you have the sebaceous gland, which is actually a holocrine that developed as part of the hair follicle complex. This sebaceous gland will secrete sebum, which is made up of triglyceride and cholesterol. Okay. And then you have the apocrine sweat glands or the epitracheal gland. So these also develop as part of the hair follicle complex, which opens via excretory ducts into the pillary canal of the hair follicle. What it secretes is that this fatty sweat secretion, which usually are very thick but clear in color. And this type of gland is usually solely, meaning is the only gland that is found in hoof animal like horses, camels, and donkeys. Okay, and then you have also the equine sweat glands or the atracheal gland. This one open directly to the epidermal surface and it will secrete a mirocrine secretion. So the secretion is usually watery and salty. That's why it's very thin, watery, but clear. And this type of equine gland are normally found in dogs and cats in the pets and the paw. So you know cats and dogs, they don't really sweat like, for example, camels and horses, because they can only sweat through their paw pads, right? Because of this, equine gland is only present in their paw pads, because the other part of the body have the very compound, the compound hair follicle. So the skin is different from the horses, okay, or the camels. All right. Question. You have diagram 1 here. Diagram here. 1 is label here and number 2 is label here. So which is which? Can you name the gland number 1 and number 2? Anyone?
Doctor.
Doctor, can I try?
Okay, sorry.
Sorry. Is number 1 sweat gland and number 2 sebaceous
Yes.
gland?
Okay, everyone agree?
Yes.
Agree.
Yes.
Yes, very good. You all very smart. Yes. So for one is actually the sweat gland and number 2 is sebaceous gland. Some people might have problem telling them apart, but remember, for me, you have to just remember that the sweat gland is usually composed of columnar or cuboidal, alright, usually single layered epithelial type of cell. But sebaceous gland is always in a cluster. Okay, like for me, and always in a cluster. That's what I would say the typical feature to differentiate between the two. But remember, sometimes you might not see the sweat gland like this. Sometimes it might be sort of pushed down, or how to say stretched out. Because if let's say the gland is dilated, the lumen is big, so the cell will become flattened. Okay. So yeah, that's the, sometimes you have to identify that. So it doesn't normally, I mean, sometimes it doesn't look like this. It might appear very flattened because the gland is dilated. So the lumen is big. Okay, it's pushing down on the cell. Okay. So yeah, this is type of compound hair follicle, right? Because it composed of not one hair follicle. Okay. Alright, so next we have the mist, or also known as the corium. So this the main function is to support and nourish the epidermis and all the appendages. Okay, the mist composed of collagen, reticulin, which is known as immature collagen, and elastin fibers embedded in a glycosaminoglycan-rich ground substance. Okay. In addition to fibroblasts in the dermis, you might also see inflammatory cells or certain cells, for example, mast cells, mononuclear cells, usually the lymphocyte and macrophages, eosinophil and neutrophil. But keep in mind, the number is very, very minute. It's like a few cells only, not many. So, see this cell, for example, a lot of mast cells in the dermis, what should come into mind? Anyone? Yes?
Allergic ada tu.
Allergy, I would say what? Allergy usually what?
Inflammation.
Inflammation. No, inflammation can be any type of inflammatory cells. But if you see a lot of mast cells, numerous mast cells in the skin, what should come into mind?
Infection.
No. Have you guys heard about mast cell tumor? Okay, maybe not alright. Yeah, mast cell tumor is example when you see numerous mast cells in the skin, okay? So tumor, definitely there'll be a lot of these cells, right? Abnormal proliferation of the cells. So yeah, mast cell tumor is usually associated with numerous amount of mast cell in the skin. Okay, what if you see like eosinophil? A lot of eosinophil. What could be the possible differential diagnosis or diagnosis?
Doctor, is it parasitic infection?
Yes, very good. That's one. Just now you mentioned before. I mean, what else? Just now you did mention. You guys did mention.
Inflammation.
Not inflammation, no.
Allergy?
Yes, allergy. Allergy also you would expect to see a lot of eosinophil. How about neutrophil?
Doctor, bacterial infection, is it?
Yes, very good. Yes, neutrophil is often associated with bacterial infection or acute type of inflammation, all right? Because they are the first line of defense to go to the infection site, right? And then how about lymphocyte or macrophages?
Doctor,
Yes.
is it virus infection?
Virus can, yes, that's one of it. You can expect to see lymphocyte, for example, in lymphoma. Sometimes you do have epitheliotrophic lymphoma, whereby the lymphoma is only at the epidermis or the skin. Okay, because lymphoma can occur systematically or in the skin. So epitheliotrophic, as the name implies, epithelial layer of the skin. Tropic meaning it is fond of the epithelial cell. So epitheliotrophic lymphoma is example where you see a lot of lymphocyte, not looking lymphocyte, yeah. And then macrophages, lymphocyte together, most of the time you expect to see in also cases like chronic type of infection. Okay. Macrophages alone or histiocyte, for example, can be histiocytoma, for example, or histiocytic sarcoma, which is a tumor. Okay. All right. So that's why looking at the type of cell, you can sort of tell you what is happening in the skin. So that's why this is sometimes you might need to take a biopsy sample of the skin in order for you to help with your diagnosis of skin diseases. Okay. All right. So superficial dermis has finer fibers than deep dermis. Okay. Okay. So what do I mean by that? Okay. Looking at here, this is under special staining so that you can visualize it better. All right. So when I say superficial meaning the outer or the topmost layer of the dermis, and this deep dermis is the one is more deeper, right? So if you can see in this image, you can see like these strands, right? The arrow are pointing towards the strands. So those are the ones that I mentioned. Here you can see more strands in the deep layer of the dermis, but in the upper layer of the dermis, you don't see those strands. So those are fine, and these are a bit coarse or thicker. Okay, so dermis are composed of two layers. The papillary layer here, the uppermost part, and then you have the reticular layer or the deeper part of the dermis. So the deeper part of the dermis, they have this dense connective tissue, and most of the time you will see the sweat gland or sebaceous gland also in the deeper part of the dermis. Okay, all right. Last but not least, we have also the hypodermis, the subcutaneous layer or the subcutis. So this layer actually function as heat insulator and also give contour to the body. So when it, heat insulator because of the fat, right? The adipocyte or the fat tissue in the hypodermis, and give body contour because why? If you see, I mean, for example, at the buttocks, right? You have more fat there, right? So it gives cushion also. So it gives not only shape but also cushion to if let's say you fall on your back, for example, right? And then yeah, hypodermis composed mostly of lipocyte or adipocyte. There are also blood vessel, nerves, and connective tissue. The cutaneous vasculature consists of the superficial, middle, and deep, and nerve fiber in general follows blood vessel, while the lymphatic present in the superficial part of the dermis. Okay, all right, okay. So remember, skin, one of the function is also as a tactile or sensory organ. So definitely when you talk about sensory organ, there should be nerves, innervation in the skin, okay? And then these nerves are usually governed by the sympathetic autonomic nervous system. Autonomic meaning we need something that is fast reaction. So let's say you accidentally touch a very hot surface, definitely you need to remove your hand fast, right? So this is why you need the sympathetic autonomic nervous, meaning you don't have to think. It's just when the skin, I mean the hand touches something hot, it definitely will remove itself automatically, okay? And very fast reaction. All right, and then okay, There are many types of nerve in the skin. You have the myoclonic corpuscle, which is responsible for light touch, very light touch and heat. And then you have the free sensory nerve ending, which is responsible for the sensation of itch, pain, touch, pressure, temperature. You have the Pacinian corpuscle, responsible for the pressure mechanoreceptor. And then here I would say the most important one would be this one, the free sensory nerve ending, because you know when you are working as a vet later one day and you when you encounter animals with the common problem that owners will send the animals to you would be animal is always, you know, like playing guitar. You know what I mean? One animal, my dog is always playing the guitar, my cat is always playing the guitar. Can you imagine?
It's itchy.
Yeah, it's very itchy. So this is very common problem that you will encounter when you become a practitioner. Itchiness is actually a mild type of pain actually, and it can be due to the problem in the nerve ending. Sometimes doesn't have to be other problem. It's just the nerve ending is something wrong there, so the animal will constantly feel itchiness. Okay, so that's one of the itchiness is one of the most commonly presented clinical sign in animal really skin defect. Remember I mentioned there are different type of skin, the thin skin, the thick skin. So this type of skin is normal. Sometimes in animal, but depending on the species and location. So what do I mean by this? Okay, if you're looking at the species, can you identify what animal this skin is from? The left hand side. Yes, very good. How about this one? Right hand side?
Chicken.
Yes. Okay. Can you notice or appreciate the thickness of the skin is different? Usually the elephant would definitely have very thick skin, right? Compared to chicken. So that's why when you fry your chicken, you get very crispy skin. This is some people like to eat fried chicken skin, right? Right. So in animal species, sometimes you might see okay, certain animal might have thicker skin compared to certain animals. And then location. What do I mean by location? Okay. For location, for example, in a cat, right? You see, okay, this nasal planum. Remember I said the foot pad and also the nasal planum are considered as thick skin. So if you compare this area to the other parts of the body, for example, the other parts of the body, the skin is always a bit thinner. So that's why in one animal also you might expect to see different types of skin. Even on the body as well, usually the dorsal part of the cat, for example, the skin is a bit thicker than the ventral part. So that's why you see the cats when they fall on their back, you thought that they like to rub their belly, but in actuality and then why? Because the belly is very sensitive of the body. It's made out very thin skin. Okay, so that's why they are very sometimes they get angry when you rub their belly. Okay. So again, the type of skin might vary on the location of the body. But generally speaking, usually thick skin are normally found on the nasal and also the foot pad. Okay, so histologically, what you would see is that in thin skin, the thickness of the stratumonium and the epidermis, the total length of the epidermis, is more usually the thickness of the epidermis, the stratumonium and the epidermis usually about the thickness is about the same. The thick skin is very the thickness is very it's very thick. I mean the thickness is more compared to the epidermis, right? And then remember I mentioned the special stratum. What was the name of the stratum just now? So stratum lucidum is only present in thick skin. So I hope you can appreciate here this lighter coloured layer here, or maybe almost white in colour or clear in colour. So that is the stratum lucidum. It is not present in thin skin. Okay. Right. Sometimes there might be differentiation whereby people will say, okay, thick skin, again, the stratum lucidum is present, but sometimes you might not see it visibly or clearly. And then the distribution is always at the planum or the foot pad. In humans, it's at the palm and the sole. Your palm, can you feel your palm and also the how you say? I mean your plantar and palmar part of your hand is different, right? Even your foot, the soles is more thicker. So that's why, because you need more layer of skin some people say in the thick skin there are actually more layers in the stratum spinosum, granulosum, and cornea. But stratum cornea definitely, usually the stratum cornea is definitely more thicker in the thick skin. Whereas in the thin skin, definitely there will be no stratum lucidum. Distribution is most part of the body is made out of thin skin, except for body from sensor or the nasal planum and the polar pad. And most of the time there are full-cell layers in stratum spinosum, granulosum, and corneum. Right. Okay. So if you are interested to do more revision on skin, you can have a look at these videos that I've shared, and then we can. So this is the last slide. This is basically to conclude that you have to remember whenever you are faced with a patient with skin disease. Okay, you have to in and rule out a lot of things, because skin is affected by many factors, exogenous and endogenously. Okay, and that's why you need to do a thorough history taking, looking at the age and also the breed. For example, certain breeds are predisposed to certain skin disease. And then you have to perhaps do more diagnostic workup, maybe take skin biopsy, for example, scraping, fungal culture or bacterial culture, for example. Okay, alright. So here that's why diagnosing skin disease is not straightforward. It can be complicated. So bear in mind all these factors. So for example, exogenous factors meaning factors coming from outside. Nutritional, if you don't have enough nutrition, definitely your skin will not be that flawless or beautiful. Okay, definitely if you look at the stray dogs or cat, they have very poor skin condition, right? Because usually they don't get enough nutrition. Then there might be microbial. If you your for example animal immunosuppressed, for example, or even don't have a very good immune response, for example, they might succumb to microbial infection easily. This example would be like maybe puppies. Usually they sometimes get rashes or even pus on the skin very easily compared to an adult dog. Okay. Chemical definitely, if you are exposed to very caustic or very irritant chemicals, then definitely you would see reaction on skin. So for example, like certain animals, they might have sensitive skin. So if you maybe you use a certain disinfectant to mop your or clean your floor, if they are sensitive towards that, you will see their contact surfaces become very inflamed. Okay. And then physical factors, could be anything, maybe traumatic injuries, maybe a cut on the skin, alright. Parasitic, definitely have like mites or maybe ticks on the skin, definitely will induce skin reaction. Actinic, any idea what is actinic?
Photochemical reaction.
photochemical, okay, solar for another word for it, right? So if you are exposed very long time under very hot sun, definitely get like reaction like sunburn, right? And in the long run, maybe even neoplasia, okay? Like squamous cell carcinoma, okay? And then allergic reaction. So yeah, allergic reaction. Endogenous factor can be immunologic. Some people they do have like systemic lupus erythematosus, for example. And then congenital. Okay, congenital meaning at birth, right? Born with this condition. Okay. Don't worry so much. We'll be looking at the different types of diseases later on in the following lectures. This is just to introduce you to these certain types of the factors that can influence skin diseases. Some diseases can be hereditary, for example, the parents have this hormone or gene, the genes that carries the dominant trait of the disease or recessive trait. Both carries the recessive trait, but it is passed on to the offspring, so the offspring will show this problem, okay? And then hormonal, for example, like hyperthyroidism or Cushing disease, right? Emotional, yes, emotional. You know, when you're stressed, you tend to secrete more sebum on the so sebum sometimes can be good, but sometimes if it's excessively secreted, it will promote you end up with acne, right? Okay. Metabolic diseases also can lead to skin manifestation. Age, like I mentioned, young animals sometimes are prone to get more infection, even simple bacterial infection because of their naive immune system. Old people usually the skin become really because of the less of collagen in the skin, or maybe because of more exposure to the sun. For example, the skin also become really wrinkly. And then in the other internal diseases, I mean anything maybe like infectious HIV, even diabetes also can lead to skin manifestation. Okay. I think that's all for the lecture today. Any question? Metabolic sometimes, you know, like I would say, example, maybe drug into sometimes antibiotic even. Sometimes because certain people are sensitive to certain type of antibiotics, so when they are given the antibiotic, also they develop rashes on the skin. Okay. Right. Any question? Senyap je.
I have a question.
Yeah.
Can we say that the sweat gland is always below than sebaceous gland?
Not really. I mean, sometimes it depends, because sometimes when you look at histopathological section, it depends on your plane of sectioning. Okay, so I wouldn't say you have to look at the landmark. You have to know they are present in the dermis, but the location wise sometimes might vary when you look at the histopathological slides. So I wouldn't say you have to see the sweat gland is a bit more deeper than the sebaceous gland. But I mean theoretically, yes, sweat gland usually they are more deeper than the sebaceous glands, because sebaceous glands are usually very they located next to the hair follicle most of the time. But again, be very careful because it depends on the plane of sectioning. Okay.
Okay, thank you, doctor.
Any other question?
Doctor, I have a question.
Yes.
Why some parts of the body, like the palm, the foot pad, legs, hair follicle, doctor?
Legs hair follicle. Because you know the hair follicle doesn't appear there because of very thick skin in nature, and because of the thick skin usually you don't need the hair follicle to be there. Okay, because the hair follicle, how to say those are the area where you need more protection rather than the hair follicle to be there. So you need the skin to be thicker. So when you have thicker skin, the hair follicle cannot really, sort of function there. Get what I mean?
Alright, doctor, thank you.
Okay. Alright. It's 11 o'clock. I think you have class, right? After this?
No, doctor.
Oh, no. Alright. Oh, okay. Any other question?
Doctor, I have a question.
Yeah.
On slide the mid slide where there's the histology picture, histology of the mid scan. I just want to ask the confirm the arrows is basically so I just want to ask the three arrows at the corner right, it just show tadi betul doktor.
Oh, yang color tu ke?
Ya tadi tu yang tadi doktor tunjuk that was yeah.
Color.
Doctor slide
24. Oh, yes. Yeah. This one is just to show you that the difference between the deeper and the deep dermis and the superficial dermis. The deep dermis usually you see this very, very coarse kind of fiber, connective fiber compared to the dermis papillary layer. These are usually made out very fine. You see, very fine compared to this one. That's the difference basically. This is usually special scene. So if you do not use special scene, you might not be able to see this this structure.
Right. Thank you so much, doctor.
Okay. Anything else? If none, then I guess I'll see you on Wednesday. I'll give you the meeting link later on, and I'll upload the notes in Talk. Hopefully they soon enough. Alright. Okay. Yes. Question. Chat. Okay. Hold on. Is it common to diagnose skin disease? Yes. Actually, yes, it's very common. How to avoid it? Test, but in reality, I don't want to proceed with the test. Like you do have a very attention to it. Certain so it may be taking very samples that are easily obtainable, but you think it's would help you in your diagnosis. For example, if you suspect there is for example maybe tumor of the skin, for example, you can always take the FNA, try take the fine needle aspiration and see what type of cells are in the nodules or the masses under the skin, for example. It might tell you might give you a clue. In case where owner a bit reluctant for you to take a chunk of the tissue, take biopsy is very invasive sometimes, so owners might not be happy with that, but yeah, so you can resort to something less invasive, or maybe looking at the course one. Maybe let's say you do skin scraping is definitely much cheaper than for you to take a skin biopsy, for example, right? So you have to, diagnosing can be very tricky and also challenging. But you have to look at what options that you have and discuss with the owner how far you can go with taking samples and so on. But I would say take the easier sample which is not economically feasible for the owner and also at the same time would benefit you. For example, maybe if you take it might value something. So again, you have to relate with all the information that you have. Okay. Signal history. With that clues, I try to come up with the most likely diagnosis, and after that we can rule out each other diagnosis. Because sometimes as an example, allergy testing is very very expensive and not many places. So sometimes you do have to process overseas. But in your house, for example, diseases. Okay. Any other question? Because I'll be handling both group alone, so I was wondering we need to adhere to the SOP. So if I'm not mistaken, one table can accommodate maybe maximum 6 of you, and we still need two places, but I can't be at 2 places at the same time. So yeah, basically is going to be looking at images, and I'll give you a set of questions for you to answer based on the images projected. But I think we can do it this Friday. I think we have a face type of practical, but we need to adhere to the SOP. So going to need your cooperation to distance yourself from each other, and we try to work out this Friday. So Friday can we start about 30, I think. 30 should be that we can finish early. I think not more than 3 hours, maybe 2 hours max. Maybe first group 30, the other group come at 2 o'clock. Easier for me to, because after answering the question, I will go through the answer with you guys. So I'll go with one group first, and then after that the group has completed, then I'll go and explain the answer to the other group. So maybe the group 1 we start 2:30 to at 3 o'clock. I think we should be able to manage. Okay. Any other question? It's probably okay. Any other question?
No, Doctor.
Okay, there's none. I think I'll see you guys on Wednesday. Right. Yeah. Alright. So thank you guys. Have a good nice day.